My name is Iwona Alfred, and I come from ITDP, Institute for Transportation and Development Policy. We are globally based, not-for-profit, but we focus on Global South, and we help local governments in countries and regions where we work and communities initiatives on sustainable transportation and urban development. So this presentation will be focused on that built environment lens, as Itai said. But first of all, I think we ought to define what are the family health outcomes first as related to built environment, which that may add a little bit to the conversation, the dialogue that Susan led this morning and the speakers before. So first of all, the family needs are dictated by their day-to-day activities. So families really need local services that are walkable, along safe routes, engaging routes, so that the primary caretakers or caregivers can easily reach them. They also need access to public transportation so that those that work can also work and support the family. We may think those are like super basic things, but actually, some communities are very disproportionately served when looking at these characteristics because of land use misalignment with transportation, poor planning, which I'll get to it in a second. We also have to look specifically at how family members move. So the usual breadwinners, who happen to be typically men, usually do more straightforward trips during the day. They take either their personal car or public transportation to go to work, and then the caregivers make more trips. They have to take care of far more things, going shopping, dropping off their kids at daycare, eventually going to work, maybe caring for other family members. So those persons who happen to be women prefer shorter trips, more convenient. They prefer walking, cycling, and taking a bus. But again, sometimes those conditions are not enabled. Here's a quick snapshot how caregivers travel. They travel with other people with packages during off-peak times when maybe the transport services are not as frequent. So families also need quality public realm because that's where they spend time outside of their homes. So those conditions also need to be as safe as the home environment. This is like, taking your living room out to the outside where you want to interact with your child, enable that quality time so that the child can, be stimulated, can learn, you can interact with your kids and other caregivers, right, in a space. Sometimes those interactions are not possible when you are just like stuck at home or busy, doing chores. So interacting with others is also very important. Well, however, as we know, many cities are designed for cars. This could be a snapshot from, LA or somewhere in Florida. It's because as cities grew in the middle of 20th century, they're really designed for cars. So we weren't thinking in many places about those short trips and engaging public realm or mixed uses. So those are the conditions that we are now grappling with. We are sort of like trying to retrofit those characteristics. And on top of that, we are also dealing with legacies of separating people, right? The redlining. So that's another snapshot of how those the conditions for access and mobility are bad in many places. So to highlight, when we put family needs that are outlined first, it's actually a good approach because it benefits everyone, right? Like if we have walkable mixed communities served well by sustainable transport modes, communities that are safe, equitable, accessible to many income levels, we're actually benefiting everyone. But the success of those intended outcomes really relies on the degree of public participation, right? That this is what we're talking about, how we enable communities to not only participate, but have the sense of agency. And we, either as NGOs or local policymakers, we need to understand those community needs, their strengths and weaknesses to work for them. So I just thought that I threw a very well-known example from our backyard. This is Melrose in the Bronx, in South Bronx. So this is what South Bronx used to look like in the 60s and 70s, the famous Bronx burning. In the early 90s, the city had its urban renewal plan for the neighborhood, which was envisioning like this transformation geared towards more like wealthier families, like single-family homes where people would drive. But the local community really like stood resilient, and little by little they started organizing, meeting as a group, and they formed this group called We Stay. You may be familiar with it. So they actually came up with their own plan for the neighborhood, which was more oriented towards the families that already lived there, no displacement measures, much more densely knit community. And also they envisioned preserving some of the vacant land that was, the result of this, and transforming it for community gardens, creating more equitable housing for a huge underprivileged population, including also homeless people. So the result is impressive. If you have a chance to maybe visit Via Verde, you really have to walk around Melrose and see how pleasant it is, how it's transformed through the years. Also, I want to highlight the role of local leadership. So, of course, it's the community needs, but it's understanding the needs of your constituents. So I threw this quote from a current and former mayor of Bogota, Enrique Peñalosa, who used this lens of children, and he utilized it for his campaigning for better mobility, implementing bikeways and BRT systems and better space for pedestrians, and this was very resonating within the city, so he could convey his campaign messages, and he did really transform Bogota City in early 2000s. So I'll close at that. I hope I fit in the 3-minute presentation time.
Thank you.
Thank you.